So, you're thinking of moving to the South Carolina Lowcountry, whether it's Bluffton, Beaufort, Hilton Head Island, or Jasper County, and you're wondering what is the quality of the healthcare in this area. Well, that's exactly what we're going to talk about today. I'm going to interview Renee Bannon, a local expert that helps run a local rehab hospital in the area, and we're going to talk about the good, the bad, the positives, the minuses, everything you need to know about the local healthcare system. Let's get started. Do you want to know everything there is to know about the South Carolina Lowcountry, whether it's Bluffton, Beaufort, Hilton Head Island, or Jasper County? Then subscribe below and tap that bell for notifications so you'll be the first to know about the current market here in the South Carolina Lowcountry. My name is David Simcox, host of Lowcountry Lifestyles and a local realtor. I get calls and emails every day from people just like you and you looking to make their move to the South Carolina Lowcountry, and I absolutely love it. So whether you're making your move in 3 days or 3 months, give me a call, shoot me a text, send me an email, or book a Zoom call, all in the description below, so you'll be the first to know about the current market in the South Carolina Lowcountry. So today I'm going to be interviewing Renee Bannon, a local expert who helps run a local rehab hospital here in the Lowcountry, and I'm going to be asking her all kinds of questions about the quality of healthcare here in the Lowcountry. And I'm doing that because that's a question that I get asked all the time as a real estate agent, because I have folks coming here from New York, New Jersey, Ohio, Pennsylvania, California, and beyond, and they're coming here maybe to retire or to raise their family or to relocate for a job, and they want to know what is the quality of the healthcare system. So let's get started right now and find out the answer to those questions. All right, so today I'm here with Renee Bannon, and Renee Bannon helps run a rehab hospital here in the Lowcountry, and she is my local expert. So thank you for being on camera today, Renee.
Glad to be here.
So the reason I have you on camera is for all of the viewers. We have a lot of people from New York, New Jersey, Ohio, Pennsylvania, California, and they're thinking about relocating here to the Lowcountry, whether it's Bluffton, Beaufort, Hilton Head Island, or Jasper County. And a question that I get asked all the time is, what is the quality of healthcare in the Lowcountry, especially, if they're thinking about retiring here. Mm-hmm. So I guess the first question for you would be, how do you define the quality of healthcare in a region?
Mm-hmm. Well, that is challenging because of course it depends on the metrics that you're using. As compared to perhaps the northern areas, of course, they have a little bit more healthcare, but not necessarily better quality. So there is a couple of ways, just as a consumer, that you can measure that quality, and that's by going on Medicare.gov. Okay. And that actually can give you specific facilities and how they measure as it comes to metrics specific to certain areas of healthcare, which is helpful to consumers to have that information.
Okay. And so here in the Lowcountry, we've got Bluffton, we've got Beaufort, we've got Hilton Head Island, we've got Jasper County. What different types of facilities are in this region? Hospitals, primary care specialists, how are those broken down?
Sure. So we have 3 major acute care hospitals in the area, one on Hilton Head, one in Hardeeville or the Okatee area, and then one in Beaufort. And so those hospitals provide a certain level of care, of course. They have your various specialists. They're also expanding as we speak and really seeking out additional care. Primary care providers is something that is in the need for this area. And so that's something that they're actually all heavily recruiting for this area as our population is expanding and increasing the need for that. So there's those levels of care locally, and then also, of course, if there is a higher need, we're really geographically located well because we're just south of Charleston at MUSC, which is a great facility. So if there is a higher level of care, higher level of specialty that is needed, patients can seek that level in Charleston and or just south to us 30 minutes or so in Savannah. And so for patients that need that level, and we actually work with a lot of those hospitals locally, They're sent out, and then we're bringing them back to continue that level of care once they're ready for that.
Okay. And obviously the Bluffton and Hilton Head market, they're prime retirement communities. Some of the biggest in the Southeast. We've got Sun City, we've got Latitude Margaritaville, lots of retirees on Hilton Head Island. What are the most common, I guess, concerns, or like what specialties do people generally, if they move here, what are they looking for?
Sure. So PCPs is one of the major ones that they're initially wanting to get started and find a PCP provider. And we do have a little bit of a wait list here, but we also have a growing market, which is great because the local hospitals and healthcare providers see that need and are actively recruiting for PCPs in the area. The other piece of that is there's more coming in, and there's other alternative routes. There's a couple that actually will go into your home and be your PCP provider. So a lot of different ways to kind of go about that. The other specialty, of course, oncology is a big specialty, ortho is a big specialty. And so we do actually have plenty of that in this particular area. And of course, if there needs to be more, they can seek that in Charleston and or Savannah.
Okay.
The other thing that I wanted to share, now I'm not an expert on this per se, but there is currently some legislation with regards to a certificate of needs, which is required in South Carolina to expand or introduce new levels of healthcare in our area. It's currently in the process of a new bill either being repealed or reformed. Either way, it means that we're in the process of expanding our healthcare in the area, which is great for us here in Lowcountry.
And I know when I leave like Sun City, for example, and I go out the back gate, I see so many medical offices and so many specialists over there. What are some of those offices, and how do you feel about the accessibility and the quality of just the things that are in the immediate vicinity to some of those neighborhoods?
Yeah, so there's a ton of great opportunity for choices with regards to ortho care in particular, which is very important for kids as they're having accidents and breaking bones.
I learned that firsthand. Jackson broke his arm.
Yes. And that was really why a most recent standalone emergency room that was recently, opened in Okatee, that was really to meet some of those more urgent, emergent needs. So ortho is one of those that's very accessible. We have quite a few amazing ortho docs in the area from both of the healthcare facilities. The other components, cardiologists, we have a good array of cardiologists in the area.
Okay.
Oncology is another. We've recently had more oncologists come, and we actually have some from MUSC coming to the local facilities here. And so you're seeing those add into those particular areas.
And folks that are coming in with their family and relocating here,
yes.
What would you say about like the pediatric doctors and what's available?
Sure, yeah. So I'm an RN by trade and was a postpartum nurse and had a great experience. Actually, I delivered my son at one of the local hospitals, and then I worked in the postpartum department at another. And I would say we have really outstanding care with regards to our OBGYNs. The availability at the hospitals with delivering, it's a great experience. The doctors are amazing. One of the local hospitals just recently increased the level of care for their NICU capabilities, which is pretty exciting for our area. So I would say it's a great location to deliver your baby. It would be a good experience. There are a lot of great resources in the area. So I would definitely highly recommend that.
Okay. So I guess last question. I know you're an extremely busy woman. She took a break from her very important job here to spend a few minutes with me, so I appreciate that. Yeah. But last question. In your opinion, should people feel comfortable moving here knowing that their needs are going to be met in a way that they're accustomed to? Right.
It's different, and to be perfectly honest, the pace is different here. As we know, we all moved to this area to have a more relaxed lifestyle, right? So the pace is a little bit different, but I think with all confidence, I can say it's a great area to move to. Be confident in the care that you're going to receive healthcare wise. We are currently expanding, and as you mentioned previously with regards to the population, this is a retirement community, and so that is, of course, there's going to be higher needs with regards to healthcare. And luckily, our healthcare providers in the area have seen that and recognized that and are actively working on bringing in even more into the area. So we're not going to be going backwards, we're going to be growing and adding specialists and adding levels of care to our area. So it's going to do nothing but get better.
Awesome. Well, hope you guys enjoyed that. Thank you so much, Renee. You're the best.
You're welcome.
And you're also one of my oldest and best friends
Yes.
in this area, so really appreciate it. And you guys, hope you enjoyed that, and that's all for today. All right, thank you guys for staying till the very end of this video. I hope you learned something about the quality of healthcare here in the South Carolina Lowcountry. I really appreciated Renee being on camera with us. And again, if I can help you find your Lowcountry lifestyle, give me a call, shoot me a text, send me an email, or book a Zoom call, all in the description below. And don't forget to like, subscribe, and tap that bell for notifications so you'll be the first to know about the current market in the South Carolina Lowcountry. My name is David Simcox, and I really enjoyed spending time with you again today.